Hey there, friends! Welcome back to our health channel, where we dive deep into keeping you vibrant, strong, and thriving, especially if you're over 60. Today, we're tackling a topic that hits close to home for so many of you: nutrition, food, and the supplements you might be taking every single day, thinking they're your ticket to better health. I'm talking about those little vitamin pills you pop with your morning coffee or evening tea. The ones you believe are boosting your heart, strengthening your bones, or sharpening your memory. But what if I told you that some of those well-meaning choices could be quietly putting your health at risk? What if one of those tiny capsules could be setting the stage for something as serious as a stroke, nerve damage, or even brain bleeding while you sleep? No warning signs, no chest pain. Just one moment you're fine, and the next your world is turned upside down. Your words slur, your arm won't move, or your balance is gone. I know this sounds alarming, but as a brain doctor who's worked with seniors for years, I've seen too many people, good, careful people, harmed by the very supplements they thought were protecting them. This isn't about fear, it's about truth, clarity, and giving you the tools to protect your brain, your body, and your independence as you age. So, grab a cup of tea, get comfortable, and let's walk through 9 common vitamins and supplements that could be silently increasing your risk of serious health issues. More importantly, we'll talk about what your aging body really needs to thrive, through food, balance, and smart choices. If you find this helpful, drop a 1 in the comments below, and if not, a Lou lets me know how I can improve for you. Let's dive in! Let's start with something you're probably taking right now: vitamin D. It's the darling of the supplement world, especially for seniors. You've heard it's essential for strong bones, a better mood, and a robust immune system, and it is, in the right amounts. But here's the thing most people aren't told: too much vitamin D, especially in high doses or taken at the wrong time, like before bed, can create the perfect storm for a stroke while you sleep. I'm not exaggerating. I've seen it happen far too often in my practice. Let me tell you about Mr. Joseph Harris, a 72-year-old retired school bus driver from Ohio. Joseph was the picture of responsibility. He ate well, stayed active, and every morning, like clockwork, he took a handful of supplements, including a 10,000 IU vitamin D capsule he'd ordered online. He'd read it would protect his bones and prevent fractures, so he never missed a day. One morning, his wife found him collapsed on the kitchen floor, his speech slurred, his right arm limp. No warning, no pain the night before, just a sudden, silent catastrophe. A stroke in his sleep. When we ran his labs, the results were shocking. His blood calcium levels were dangerously high, his arteries were stiff, and his blood pressure was all over the place. Joseph didn't smoke, didn't drink, and ate a balanced diet. The culprit: vitamin D toxicity. Here's what happens: high doses of vitamin D cause your intestines to absorb too much calcium, flooding your bloodstream. Your body doesn't know what to do with all that extra calcium, so it deposits it in places it doesn't belong, like your arteries, kidneys, and even your heart valves. Over time, this hardens those tissues, narrowing the pathways your blood needs to flow through smoothly. In the early morning hours, when your body is dehydrated, your blood pressure fluctuates, and your oxygen demand spikes. This sets the stage for blood clots. One clot in the wrong artery can steal your speech, your movement, or even your life in an instant. The scariest part: many seniors believe more is better. They're taking 5,000 IU, 10,000 IU, or even more every day, sometimes on top of calcium supplements or heart medications, without ever checking their vitamin D levels. The truth is, the recommended daily intake for older adults is just 600 to 800 IU, and even that should only be taken if a blood test confirms you're deficient. Anything more, especially without a doctor's supervision, is like playing with fire. Vitamin D isn't just a vitamin. It's a hormone that controls how calcium moves through your body. It affects your vascular health, your kidneys, and your heart rhythm. Taking it lightly is a mistake you might not feel until it's too late. My advice: always take vitamin D in the morning when your body can process it best, never before bed, and always have your doctor check your calcium and vitamin D levels together. Joseph survived his stroke, but he now walks with a cane and goes to speech therapy twice a week. He told me, "Doc, I thought I was doing everything right. I had no idea I was pushing my body toward a stroke." That breaks my heart because he's not alone. Thousands of seniors across the country are unknowingly putting their brains at risk, all while trying to stay healthy. If that made you pause, let's talk about vitamin E, another supplement that's often seen as a hero for heart health, circulation, and even memory. For years, doctors encouraged seniors to take it, and it's still a staple in many medicine cabinets. But what I've seen in my practice has me deeply concerned. In high doses, especially when combined with blood thinners like warfarin, aspirin, or Eliquis, vitamin E can thin your blood to a dangerous degree, increasing the risk of bleeding inside your brain. Let me share the story of Mrs. Eleanor Brooks, an 81-year-old retired librarian from Toledo, Ohio. Eleanor was sharp as a tack, loved her books, crossword puzzles, and baking for her grandkids. She was meticulous about her health, watched her diet, walked daily, and faithfully took her medications, including warfarin for a minor heart valve issue. But she'd read in a senior health magazine that vitamin E could boost circulation and memory, so she added an 800 IU capsule to her routine. The bottle promised antioxidant support and heart protection, so it seemed harmless. 3 weeks later, she was rushed to the ER, vomiting, dizzy, confused, with a pounding headache. She could barely speak. A CT scan revealed a hemorrhagic stroke, active bleeding in her brain, not from high blood pressure or trauma, but from a fragile vessel that burst because her blood was too thin to clot. Here's the deal: high doses of vitamin E act as a natural anticoagulant, preventing your blood from clotting properly. That can be helpful in very specific medical situations, but if you're already on a blood thinner, adding vitamin E is like pouring water into an already overflowing glass. Even a tiny vessel in your brain can give way, and there's no stopping the bleed. Most over-the-counter vitamin E supplements contain 200, 400, or even 1000 IU per capsule, way more than the recommended 22 IU daily for seniors. And there's no big warning label, no pharmacist checking your supplement stack. Eleanor assumed if it was a vitamin, it was safe. She survived, but her short-term memory took a hit, and she now needs assistance to walk. She told me with tears in her eyes, "I was just trying to help my heart. I didn't think I was hurting my brain." If you're on blood thinners and taking vitamin E, especially in doses above 100 IU, stop now and talk to your doctor. Get your blood checked. A single capsule could tip the balance between life and irreversible brain injury. Now, let's move to vitamin B6, often marketed as a nerve and brain booster. You'll see it in supplements promising sharper memory, better balance, or relief from numbness and tingling. It sounds like a godsend, especially for seniors dealing with nerve issues. But here's the truth: too much B6 can destroy the very nerves it's supposed to protect, sometimes permanently. I'll never forget Mr. Harold Jenkins, a 66-year-old retired truck driver from Kansas. Harold was a proud grandfather who loved tinkering with engines and telling stories from his days on the road. But over a year, he started noticing tingling in his feet, then numbness. He began tripping around the house, his hands felt weak, and after his third fall landed him in the ER with a gash on his head, he came to me. When I reviewed his supplement list, I saw he was taking a popular nerve support formula marketed to seniors with 100 mg of B6 per tablet, 2 tablets a day, a totaling 200 mg. The safe upper limit for seniors is just 25 mg, including what you get from food. Here's why: this tertiary B6 is water-soluble, but in high doses over time, it builds up in your nerve tissue and starts stripping the protective sheath around your nerves, like insulation off a wire. This causes misfiring signals, leading to tingling, numbness, weakness, tremors, and even irreversible nerve damage. Harold's symptoms weren't from aging or arthritis, it was a slow, silent vitamin overdose. The scariest part: the damage creeps up gradually, and many seniors dismiss it as just getting older. We stopped Harold's supplement immediately, and he regained some strength, but the nerve damage in his feet hasn't fully healed. He uses a cane now and can't drive. He told me, "Doc, I took it to protect my brain. I didn't know I was poisoning it." If you're taking a B6 supplement, especially one for nerve support or energy, check the dosage. Anything over 25 mg daily is a red flag. Talk to your doctor to avoid trading a minor issue for a lifelong one. Next up is vitamin A, often touted for eyesight, skin, and immunity. It's in multivitamins, eye health supplements, and anti-aging formulas, and it seems harmless. But in high doses, vitamin A can build up in your body, raise pressure inside your skull, and mimic stroke symptoms. Take Miss Dorothy Simmons, a 79-year-old piano teacher from Oregon. She was vibrant, teaching kids from her living room, and taking a 10,000 IU vitamin A capsule daily for years to protect her vision. Slowly, she developed headaches, blurred vision, dizziness, and slurred speech. Her family feared a stroke, but tests showed pseudotumor cerebri, elevated intracranial pressure from toxic vitamin A levels. Unlike water-soluble vitamins, vitamin A is fat-soluble, storing in your liver and brain. Too much causes fluid buildup, compressing nerves and blood vessels, which can lead to clots, vision loss, or stroke-like episodes. The safe upper limit is 500 to 3,000 IU daily, yet many supplements have far more. Dorothy's recovering but needs ongoing therapy and can't teach anymore. Check your vitamin A intake, especially if you're combining supplements, and talk to your doctor to protect your brain. Now, let's talk about niacin, or vitamin B3, often praised for lowering cholesterol and boosting heart health. It's in supplements, energy drinks, and even prescriptions, and many seniors see it as a natural alternative to statins. But high doses, especially without supervision, can destabilize blood pressure and trigger strokes. Mr. Frank Miller, an 82-year-old retired postman from Florida, started a heart-healthy supplement with 1,000 mg of niacin per serving, taking 2 daily, 60 times what he needed. He woke up flushed, dizzy, and anxious, with racing heartbeats. One morning, his speech slurred briefly, a mini-stroke caused by vascular stress from niacin's rapid vessel dilation and constriction. This yo-yo effect strains aging arteries, risking clots. Frank's imaging showed arterial narrowing, and we stopped the niacin, stabilizing him through diet and meds. But he was shaken, saying, "I thought I was avoiding statins, not gambling with my brain." Stick to 30 to 50 mg daily unless your doctor advises otherwise, especially if you're on heart meds. Folic acid, or vitamin B9, is another one that seems harmless, vital for pregnant women and heart health. But in seniors, excess folic acid can mask a vitamin B12 deficiency, silently damaging nerves and mimicking dementia. Miss Judith Monroe, a 75-year-old retired nurse from Colorado, was taking 800 mg of folic acid via a multivitamin, plus fortified cereals and drinks, totaling triple the recommended 400 mg. Her fatigue, memory lapses, and numbness were blamed on age, but blood work revealed a severe B12 deficiency masked by high folate. Excess folic acid corrects B12-related anemia but not nerve damage, which can become permanent. We caught Judith's issue in time, but many aren't so lucky. If you're over 60, check your B12 levels regularly and avoid folic acid overload. Vitamin C is everyone's favorite, believed to fight colds and aging, but high doses 500 mg or more daily can harm kidneys and arteries. Mr. Robert Langston, a 78-year-old from Indiana, took 3,000 mg daily from multiple sources, leading to kidney stones, reduced function, and arterial calcification. Vitamin C breaks down into oxalates, which form crystals in aging kidneys, and can promote calcium buildup in arteries, raising clot risk. Stick to 75-90 mg daily, ideally from food, and get kidney function tests if you're taking more. Multivitamins seem like a safe bet, but many are overloaded with high doses of vitamins A, D, E, C, B6, and niacin, overwhelming aging systems. Mrs. Jeanette Wallace, A 73-year-old from Indiana suffered headaches, dizziness, and confusion from a senior multivitamin with mega doses. Her symptoms eased after switching to a food-first approach. Check your multivitamins contents and consult your doctor to avoid silent buildup. Finally, vitamin K, found in greens and supplements, can disrupt blood thinners like warfarin. Mr. Dennis Hale, a 79-year-old from Michigan, started a greens powder with 150 mg of vitamin K, causing a clot and minor stroke by counteracting his medication. If you're on blood thinners, coordinate any K-rich foods or supplements with your doctor to avoid deadly swings in clotting. So, what's the takeaway? Your aging body needs balance, not excess. Take inventory of your supplements, read labels, and talk to your doctor about blood tests for D, B12, and kidney function. Prioritize real food, eggs, greens, salmon, berries, for natural nutrients. Listen to your body's whispers, dizziness, tingling, fatigue, before they scream. You're not too old to take control. Share this with someone you love. Comment 1 if it helped, and let's keep moving forward with wisdom, one meal, one choice at a time.